And then with that, we'll move to the other bill, which is House File 1801. So I will move House File 1801 before the committee. And I'm offering the DE6 amendment. And again, this is to put the bill in the form of our division report. And then again, we'll have plenty of time to walk through the bill and testimony, et cetera. Pardon me, Representative Heitzman, sorry.
Thank you, Mr. Chair.
Yeah.
Just a clarification. I've heard you say twice that we'll be tonight having public testimony, and there'll be, I'm assuming, some time for questions during that period. Just wanted to confirm that if you members had questions relative to the bill, you're not going to be looking for those questions now. That would be coming later tonight as well.
So Representative Heitzman, so I'd say questions regarding the couple different pieces here. So questions regarding just understanding the content of the bill, now would be the right time to ask those. We'll certainly be able to ask those as well on Thursday. We'll have House research, so we may not have every one of the experts who are sitting here. I suppose that we can presumably reach on out if necessary. But if there are questions you have about the content of the bill, just sort of what's in it and understanding it, this would be the good time for that. There'll be testimony tonight. I would not anticipate questions of testifiers because this is simply the public providing input and thoughts about any aspect of the bill. And then on Thursday, so if you're talking about questions to me as the author as to why, to justify why something was included or not, et cetera, that would be, we'll have time for that on Thursday then, in connection first with amendments, but then also with the final vote on the bill. So is that a follow-up question that you may have?
That helps, Mr. Chair. But just to be clear then tonight, if we did have questions for testifiers, would we be letting us ask those if they did come up?
Representative Heitzman, I guess if there's, so I will say that when I've participated in this in the past, I have not seen questions of testifiers. I mean, I think if there's, I think at this point, just with the nature of the bills, this is the chance for the public to provide thoughts and concerns, and then if there's a point that comes out of that, certainly that you can then bring that up on Thursday and certainly interact with an individual testifier. I guess I wouldn't totally rule it out if there's some clarification you'd be seeking based on something somebody would say. But in general, I think it's just for folks to provide and for the public to provide their input. But yeah, follow up, Representative Heitzman.
That's really all I was concerned about to that second point, was if there was a clarification needed as a testifier may bring some kind of piece of information forward. I just want to make sure that we're still allowed to ask a question if necessary. So.
Yeah, and so I guess I would ask, that it be a clarifying question about something that may confuse you about something that's asked. I guess what I don't want to turn it into is often if we have a bill, you have testifiers, we end up getting into a back and forth, it's a debate about the bill, and we've got all of our time on Thursday morning and Thursday evening for that. And I suspect we'll have a bunch of testifiers, and so I don't want to get bogged down in that. So if it's something that is clarifying a question or a point that a testifier has made, then I'll allow that. But I think it gets beyond that. If it gets into opinion about the bill, or argumentation about the bill, I'm going to ask members to please save that for Thursday, and then we'll have plenty of time for that. Hopefully that makes sense. But certainly if there's a clarification, somebody says something that confuses you, a comment somebody makes, certainly that's a chance to ask that. But in general, I think we want to keep that pretty limited tonight, just focus on receiving information from the public. So thank you. Okay, so I had moved both House File 1801 and then the DE6. And again, this is to put the bill in the form that I wish, and so we can then get our House research to walk us through. Any further discussion about the DE6? And then hearing none, all in favor of approval of the DE6 amendment to put it in the form the author wishes, please say aye. Aye. Any opposed? Okay. So House File 1801 has been amended with a DE6 amendment, and now again I'll ask House Research, I think Mr. Burris, to walk us through the amended House File 1801. Or Mr. Berg, I guess, is going to start us off. Mr. Berg.
Mr. Chair and members, in this case, since the appropriations start first, it's maybe most helpful to start with the spreadsheet.
Makes sense, please.
Members should have 4 pages, I think it's 2 actual sheets, that is labeled 2019 session early childhood finance HHS items that looks like this. Just to orient you to the way human services spreadsheets look, this has got at the top of the page summary of net expenditures in the bill for all agencies. If you'll look at line 6 and go over to the center of the columns under fiscal year 2020 and 2021, you'll see that the net general fund expenditure in this bill is $46 million. And then if you follow that line over to the very right-hand column, you'll see that the net general fund expenditure in the tails is $108.3 million. Going down, there's a section for each, the Human Services Department and the Health Department that summarizes theirs. But I'll start with the individual items on line 135 of page 1. This is the same as the governor's items on Child Care Assistance Program federal compliance items. That is an $8.2 million expenditure from the general fund in 2021 and $21 million in the tails. Going to the very last line on the first page, item 143, this is the federal requirement to update our maximum rates. You see that in 2021, this cost $10.8 million and is $51 million in the tails. Going to page 2 on line 167, this is the Governor's Child Care Assistance Program integrity item. This will have an effect of saving $2.1 million in 2021 and $2.8 million in 2022 and 23. I will, when we get to the language, I think Mr. Burris will walk through, there are appropriations riders that outline, or I can't, that outline staffing changes that are come along with many of these in program integrity items. On line 189, this is the basic sliding fee waiting list item. It will, it is essentially the same as the governor's. The appropriation is just slightly smaller by about a little less than $400,000 in 2021 and $200,000 in the tails to accommodate a couple of other priorities that we'll come to in the bill. On line 194, this is the item that came up in the governor's supplemental budget for adding a staff person at the department to plan for the moving to electronic record keeping and electronic filing. That's $153,000 in 2021 one time. Moving to line 486, this is federal compliance in fees in the state government special revenue fund for license exempt centers. It has a savings of $131,000 to the general fund and $143,000 in the tails. That's largely due to the fact that the fees are being swapped from the general fund to the state government special revenue fund, creating a savings in the general fund. The last line on that, on page 2, line 494, is another item from the governor's supplemental budget involving fraud prevention in the CCAP program. That costs $2.1 million in 2021 and $2.4 million in 22-23 from the general fund. Moving to page 3 on line 500, the fraud prevention investigations expansion item. This is the governor's revised budget item, which is now projected overall to save $204,000 from the general fund in 2020, 2021, and $364,000 in the tails. I'll just pause on the detail there. When we get to the language, you'll see a lot of sections, appropriation sections that don't necessarily relate to this committee. This item involves hiring a staffer at the central office and more grants out to the counties for fraud prevention across multiple public programs, not just child care. And so you'll see as you go down the list of detail under this that there is assumed to be savings in various programs outside of this committee's jurisdiction that are part of this item. Line 5.16 is the expansion of the SIRS and CCAP investigation expansion program, again, a governor's item. This will create a savings of $74,000 in the general fund in 2021 and $200,000 in the tails. The item on the bottom of the page 3, 522, is federal compliance relative to background checks. This involves the state being required to buy into some additional databases for background checks for CCAP. It has a cost of $281,000 in 2021 and $322,000 in the tails. And moving to the last page, on line 532 is the Head Start background studies item. This appeared in both the K-12 and the Human Services sections. It nets to zero, but there are some changes in the fees. Moving down to line 537, this is the first children's finance bill that we heard, House File 2420. It puts out $1 million in 2020 and 2021 one time for loans under this program to child care providers, their business expansion and startup loans. On line 541 is the retain grants bill we heard, HF 2264. It puts $100,000 a year out on a permanent basis for the retain grants program. And on line 545 is House File 2581, which provides $260,000 in 2020 to distribute diapers at food shelves across the state. And then there's a no-cost item, which on 549, which is changes relative to the False Claims Act compliance. And then at the very bottom of the page, there is one item at the Health Department on line 630, which is a $500,000 increase on a one-time basis in fiscal year 2020 and 2021 to the home visiting state expansion program. And then again, Mr. Chair, on the front page on line 6, you see the net, which is a $46 million net expenditure in the general fund and 108.3 in the tails. And that's it.
All right, thank you, Mr. Berg. Before I turn to Mr. Burris, I just wanted to note that my packet at least had an extra copy of the DE3 from House File 2610. Well, I just want to note, because in case there was any confusion, that it is the DE6 we're working off of, and that other DE3 was just a extra copy from the other bill, so we can just disregard that. We'd already dealt with that. So return to Mr. Burris to walk us through the bill, and then his colleagues, I think, some guest stars here.
Mr. Chair and members, yes, I'll be starting with the H 1801 DE6 amendment. So this is the thick one. Article 1 contains the appropriations that Mr. Berg from House Fiscal had just walked through. So Section 1 sets up the appropriations structure. Section 2 then contains the appropriations to the Commissioner of Human Services, starting with a total. And then on page 2, subdivision 2 contains the various staffing proposals around program integrity that the Department of Human Services had proposed. So that is a series of riders on inspections, child care assistance programs, data analysts looking at fraud and abuse, the Office of Inspector General investigators, tracking system, fraud prevention investigation grant program, law enforcement contracting, as well as in the next subdivision, some other programmatic improvements. So then on page 4, there's a series of subdivisions that refer to identify some of the savings that Mr. Berg had outlined as a result of fraud investigations and fraud, waste, and abuse related initiatives. So this is what the department is currently anticipating in savings across a variety of programs as a result. Also on page 4, subdivision 11, this expresses or establishes appropriations to reduce the waiting list in the basic sliding fee program. and it outlines the methods and prioritization for allocating those additional dollars. So again, this is these are appropriation amounts over base. It's kind of expressing a change item. Subdivision 12 is at the bottom of page 5. That provides a total, then with the substantive riders on page 6. These are a couple of the other appropriations that Mr. Burgett outlined. The first is the First Children's Finance. That's site assistance grants. The language underlying that is a little bit later in this article. And then retained grants appropriation is, has statutory language that's in a later article. So we'll be sort of returning back to that. And then subdivision 13 contains the grants to food shelf programs for diaper purchases. Also on page 6 is the appropriation to the Commissioner of Health, and this is for home visiting programs, and that is associated with new statutory provision that's also in a subsequent article. And then finally on page 7 in this article, this is the grant program language around the First Children's Finance grants. And with that, Mr. Chair, brings us to Article 2.
Okay. Ms. Pinelli?
Mr. Chair and members, Danielle Pinelli from the House Research Department. Article 2 is the Early Care Finance and Policy article. It begins on page 8 of the DE6. The first 3 sections of that article are all making changes to definitions under the statute that governs the Child Care Assistance Program. It adds a definition of homeless and then modifies definitions of provider and transition year families. Section 4 on page 9, this changes the frequency of the child care market rate surveys under the CCAP program, going from every 2 years to every 3 years, beginning in 2021. Section 5 on page 9 modifies the application process for CCAP. It specifies a process that counties must use when handling applications of families who meet the definition of homeless. Section 6 on page 10 modifies the portability pool by requiring families who are receiving basic sliding fee child care assistance and move from one county to another to notify the family's previous county of residence of the move, and it also removes the 6-month time limit on receipt of portability pool assistance. Sections 7 and 8 provide continuity of care for kids who are aging out of child care assistance by allowing a family to remain eligible for CCAP until its next redetermination if a family has a child that reaches age 13 or age 15 if the child has a disability. Section 9 on page 13 of the DE requires the amount of child care authorized to continue at, oh, sorry, wrong section, I'm getting off here. Section 9 relates to assistance for families who are homeless. This makes homeless applicants for child care assistance eligible for 60 hours of child care assistance per service period for 3 months. Section 10 starts on page 13 and then goes over to page 14. This relates to the CCAP maximum rates, and this changes the maximum rates so that they're based on the 2018 Child Care Provider Survey. And then the change on page 14 to paragraph I changes the maximum registration fees that are paid and also bases it on the 2018 survey. Section 11 on page 15 begins a series of changes that run from section 11 through section 17 that are related to the fair hearings process under CCAP. Modifies this process. So section 11 modifies the process by allowing an applicant or or by stating that an applicant or recipient does not have a right to a fair hearing if a county agency or the commissioner takes action against the provider. Section 12 allows a provider to request a fair hearing only if a county agency or the commissioner has taken certain actions. Section 13 modifies the joint fair hearings process under CCAP. Section 14 on page 17 provides notice to providers. So before taking an action that's appealable, a county agency or the commissioner must mail a written notice to the provider against whom the action is being taken. Section 15 specifies the circumstances under which a provider's fair hearing must be stayed. Section 16 specifies the county agency's or the commissioner's action is considered final unless the commissioner receives a timely and proper request for an appeal. Section 17, which starts at the bottom of page 17, provides for administrative review. It specifies the conditions under which a provider has the right to an administrative review, specifies the timeline a county agency or the commissioner has for mailing a written notice to a provider when suspending payment or denying or revoking the provider's authorization. It specifies the duration of a payment suspension or the denial or revocation of a provider's authorization, and it lists conditions under which the commissioner may find that good cause exists not to deny, revoke, or suspend a provider's authorization. Section 18 is the Retaining Early Educators Through Attaining Incentives Now, the Retain Grant Program, and this is just establishing authority in statute for this program. Section 19 on page 20 is related to the Newborn Hearing Screening Advisory Committee. This section extends the advisory committee to June 30th of 2025, and it adds 2 members to the committee. Section 20, beginning on page 22, relates to home visiting for pregnant women and families with young children. This directs the Commissioner of Health to award grants to community health boards, nonprofit organizations, and tribal nations to start up or expand home visiting programs that serve pregnant women and families with young children. Section 21 on page 24 relates to appeal of department actions. And this specifies a child care provider's rights related to the department's action taken under the CCAP program fraud investigation statute. Section 22 relates to decertification of license exempt providers. It modifies the list of conditions under which the commissioner may decertify a center, and it specifies the process for a certification holder to request a reconsideration of a decertification. And then section 23 is a repealer, and that just repeals several statutes and rules related to the fair hearings process and sanctions.
Thank you, Ms. Pinelli. And are you continuing to the next article, or is it one of your colleagues? Looks like.
Mr. Chair, I believe Ms. Sunderman is going to be
Okay.
going over Article 3, and then I'll be back for Article 4.
Okay, we'll welcome you back, and Ms. Sunderman, once you settle in, you can please begin.
Mr. Chair, members, I'll be going over Article 3, which relates to childcare licensing. Section 1 incorporates 2 of Representative Pryor's bills, House File 1925 and House File 2047, with some slight changes. And this is starting on page 26 of the DE. In paragraph C, this is related to the exit interviews bill, and there's some modifications. So it prohibits the commissioner from issuing a correction order or other licensing action for violations of rule or law not discussed in an exit interview, except if the license holder chooses not to participate in an exit interview. And it requires the licensing agency to offer an alternate time for the exit interview in the event that the exit interview gets interrupted or the license holder can't complete it at the time of the inspection. Paragraph D on page 27 establishes a process for family child care license holders to dispute county licensor interpretations of a licensing requirement and allows them to request clarification from the Commissioner of Human Services and establishes the process around that. Section 2, at the bottom of page 27, is based on House File 1841, allowing for reusable water bottles in child care centers. It uses the language from the governor's budget bill instead of the language in House File 1841. Sections 3 and 4 are based on House File 740, Representative Quam's bill. Section 3, I believe, remains unchanged and requires the Department of Human Services, rather than licensed child care providers, to develop policies and procedures for reporting suspected child maltreatment and to provide the policies and procedures to the providers in plain language. Section 4 was, in the original bill, House File 740 was repealed. This is instead modified to remove an obsolete date and remove the requirement for the licensing agency telephone number to be printed in bold and large font. And it also modifies the terminology to change it from informing parents who have concerns to informing parents who have questions. Section 5 is one of these sections from House File 1926, the Delete Everything Amendment, or the DE1, I believe. And this relates to the supervision of a child care license holder's own child. It allows an individual to supervise a family child care license holder's own child without meeting licensure requirements if the individual is related to the license holder, is not an employee of the program, and if the person only cares for the license holder's own child. Section 6 and also sections 8 and 10 relate to the emergency planning federal compliance to include accommodations for infants and toddlers. And section 6 is related to the child care center emergency preparedness plans. Section 7, also from House File 1926, exempts individuals caring only for the license holder's own child, so those individuals in section 5, from any of the family child care training requirements. Section 8 from House File 1924, again, adds a requirement for accommodations for infants and toddlers in emergency preparedness plans, and this is for family child care plans. Section 9 is from House File 1926, the DE, and there are a few modifications, some sort of technical changes, but Subdivision 1 permits the use of a substitute caregiver for family child care for up to 400 hours, and I believe the previous version of this was 300 hours, and requires the license holder to document the substitute care. Subdivision 2 relates to emergency replacements in family child care. So paragraph A allows for an emergency replacement who hasn't completed training or background study requirements to provide emergency care, or care for children in an emergency situation. It also specifies what constitutes an emergency. Paragraph B requires the license holder to minimize the time an emergency replacement supervises children and specifies that the emergency supervision can't exceed 24 hours per incident. Paragraph C prohibits the license holder from knowingly using an emergency replacement who would be disqualified from providing care for children if a background study were conducted. Paragraph D requires the license holder to arrange for emergency care by a substitute caregiver rather than an emergency replacement, if possible. Paragraph E is a bit different from the last version of this. So this requires the license holder to notify the county licensing agency within 7 days that an emergency replacement was used, and then requires the county licensing agency to notify DHS within 3 business days of the license holder's use of an emergency replacement. And paragraph F specifies that the license holder is not required to provide names of substitutes or emergency replacements to parents or the county licensing agency in advance. And finally, Section 10 adds the requirement for the accommodation for infants and toddlers, and this is for certified license exempt childcare center written emergency plans. And that concludes Article 3.
Thank you, Ms. Sunderman. It sounds like Ms. Pinelli's coming back up then for the next article, was my understanding. And so, Ms. Pinelli, feel free to begin when you're ready.
Thank you, Mr. Chair and members. I'm going to be going over Article 4, the Program Integrity Article, which is the final article of the bill. It begins on page 33 of the DE6. The language in this article comes entirely from House File 2319 as it was amended, I believe, in this committee last week. So I don't know how much detail you want me to go through this.
Maybe you can just give us the highlights by section at least. I know we did just here last week, but I also want to make sure that the folks are well oriented. Yes, maybe just at a high level at least. Thank you.
Sure, Mr. Chair. So Section 1 amends a section on investigative data, allowing welfare data that is collected as part of an enforcement investigation to be disclosed to other agents within the welfare system or to other government investigators, unless the disclosure would compromise an ongoing DHS investigation. Section 2 relates to liability for certain acts. It modifies the penalty for fraud against the government under the False Claims Act. Section 3 relates to child care data. It defines child care assistance program data and classifies as private payment data that identifies an individual assistance recipient and specifies that payment data is public if it relates to payments made to a child care center under certain circumstances. Section 4 relates to the date of eligibility for assistance under CCAP, and it limits retroactive payments to 3 months from the date of application. Section 5 on page 37 modifies record-keeping requirements under the CCAP program. Section 6 on page 38 relates to provider payments under CCAP, and it requires providers to bill only for services that meet specified documentation requirements, and it expands the list of conditions under which the commissioner or county may refuse to issue a child care authorization to a provider or revoke an existing authorization or stop payment. Section 7 relates to absent days under CCAP. It defines absent day and holiday limit, and it requires providers to properly bill for these days. Section 8 relates to limits on receiving public funds. For providers who are excluded from a program administered by the Department of Human Services, it requires the commissioner to prohibit the excluded provider from receiving grant funds or registering in any other program administered by the commissioner. And it also requires the commissioner to disenroll, revoke, or suspend a license, disqualify, or debar the excluded provider, vendor, or individual in any other program administered by the commissioner, and it defines excluded and provider. Section 9 on page 42 modifies the definition of applicant under the chapter of statutes governing human services licensing. In fact, the next several sections are just modifying definitions or adding definitions under the chapter of statute that governs human services licensing. That goes through section 15 on page 43. Section 16 on page 44 modifies the list of entities that are prohibited from conducting certain actions without having a license under the Human Services Licensing Statutes. Section 17 makes conforming changes related to actions that may be taken against an unlicensed entity. Section 18, application for licensure. This makes conforming and other changes to licensure application requirements under the Human Services Licensing chapter. That section goes on for 3 or 4 pages. Section 19 begins at the top of page 49. And that allows the commissioner to provide an electronic notification to a municipality or other political subdivision that's affected by a license issued under the Human Services Licensing Statutes. Section 20 modifies the list of items a licensing inspection must include. Section 21 on page 50 modifies the list of items the commissioner must evaluate before issuing, denying, suspending, revoking, or making a conditional license. Section 22 on page 51 specifies the commissioner must issue a license consistent with Human Services Licensing application procedures or temporary change of ownership procedures. Makes other technical and conforming changes. Section 23 on page 53 requires a license holder to notify the commissioner and obtain the commissioner's approval before making any change that would alter the information that's included on the license. And it lists other changes for which the license holder must notify the commissioner and specifies the documentation that a license holder must provide to the commissioner when a license holder changes information on file with the Secretary of State. Section 24 modifies the list of entities that must meet certain requirements when applying for a license to place children for adoption. Section 25, which begins at the bottom of page 54, relates to license applications after a change of ownership. It specifies that a license is not transferable or assignable and requires submission of a new license application if the commissioner determines that there has been a change in ownership, and it lists the process for that application and for granting a license. Section 26 begins on page 57, and that modifies the list of circumstances under which the commissioner may deny a license. Section 27 sets out requirements for the commissioner related to closing a license if the commissioner determines that a licensed program has been inactive for a consecutive period of 12 months or longer. Section 28 makes technical and conforming changes to a section related to sanctions and appeals. Section 29 relates to temporary immediate suspensions, and it modifies the list of circumstances under which the commissioner must act immediately to temporarily suspend a license. Section 30 relates to immediate suspension, expedited hearings, and it sets the burden of proof in an expedited hearing as a preponderance of evidence for suspensions in cases where the license holder is criminally charged in state or federal court with an offense that involves fraud or theft against a program administered by the commissioner. Section 31 begins on page 62 That relates to license suspension, revocation, and fines, and it modifies the list of circumstances under which the commissioner may suspend or revoke a license or impose a fine. Section 32 begins on page 65. That's related to financial misconduct. It just modifies the definition of financial misconduct or misconduct under the statute that governs CCAP fraud investigations. Section 33 defines provider under the chapter of statute related to CCAP fraud investigations. Section 34 relates to administrative disqualifications under the chapter of statutes related to CCAP fraud investigations. It specifies the conditions under which the Department of Human Services must pursue an administrative disqualification, and it specifies the process for pursuing an administrative disqualification and what the provider repeal rights are when an administrative disqualification is pursued. Section 35 relates to hearing authority. It makes some technical changes. Section 36 is related to vendor of medical care under the medical assistance chapter of statutes, and it clarifies a definition. Section 37, beginning on page 67, relates to grounds for sanctions against vendors. It expands the list of reasons for which the commissioner may impose sanctions against a vendor of medical care. Section 38 on page 68 relates to sanctions under the medical assistance chapter of statutes.
Ms. Pinelli, I think that these few are related to medical assistance as opposed to early childhood programs. So maybe you could jump to the next, I think there's just a little bit left that's related to early childhood specifically.
Mr. Chair, I believe the next several sections all relate to medical assistance. I think we probably will jump to section 52 on page 79, which is the last
Okay.
section, and that establishes criminal penalties for acts involving human services programs.
Okay. I guess that's it. Thank you so much. And thanks to our amazing team of House Research staff walking through. Questions for House Research about the contents of the amended bill?